The bradycardia algorithm outlines the steps for assessment and management of a patient presenting with symptomatic bradycardia with a pulse. Implementation of this algorithm begins with the identification of bradycardia, which is a heart rate less than 50 beats per minute. Once bradycardia has been identified, first steps include the components of the BLS assessment and primary assessment, such as supporting circulation and airway management, giving oxygen, monitoring the rhythm and vital signs, establishing IV access, and obtaining a 12-lead ECG if available. The primary decision point in the algorithm is determining whether the bradycardia is causing the patient's signs and symptoms or some other illness is causing the bradycardia. These symptoms include hypotension, acutely altered mental status, signs of shock, ischemic chest discomfort, and acute heart failure. If the patient has adequate perfusion, observe and monitor. If the patient has poor perfusion, administer atropine. Classified as an anticholinergic drug, atropine is effective for the treatment of certain types of bradycardia. For example, if the vagus nerve stimulates the heart, the patient's heart rate will slow. Atropine blocks the action of the vagus nerve, causing the heart rate to increase. If atropine is ineffective, prepare for transcutaneous pacing or consider dopamine or epinephrine infusion. Transcutaneous pacing, or TCP, uses electrodes on the patient's chest to deliver an electrical impulse that overrides the normal pacemaker functions of the heart. In effect, TCP provides an external pacemaker signal. Dopamine stimulates the beta-1 adrenoceptors, resulting in improved myocardial contractility, increased sinoatrial node rate, and enhanced impulse conduction in the heart. If the patient doesn't respond to atropine, TCP, dopamine, or epinephrine, seek expert consultation. Prepare for transvenous pacing and search for and treat contributing causes. Bear in mind that the treatment sequence in the algorithm is determined by the severity of the patient's condition. You may need to implement multiple interventions simultaneously. If the patient goes into cardiac arrest, go to the cardiac arrest algorithm.